You made plans and I made problems. We were sleeping back to back. We knew this thing wasn't built to last. Yeah, good on paper, picture perfect. Chase the high too far too fast. Picket white fence, but we painted black. And I wish you would hurt me harder than I hurt you. And I wish you wouldn't wait for me, but you always do. I've been hoping somebody loves you in the ways I couldn't. Somebody's taking care of all of the mess I made. Someone you don't have to change. I've been hoping someone will love you, let me go. Someone will love you, let me go. I've been hoping someone will love you, let me go.
Spend some time, but this time ain't even. I can leave it in the past, but you're holding on to what you never had. It's good on paper, picture perfect. Chase the high too far too fast. Pick your white fence, but we painted black.
And I wish that you would hurt me harder than I hurt you. And I wish you wouldn't wait for me, but you always do. I've been hoping somebody loves you in the ways I couldn't. Somebody's taking care of all of the mess I made. Someone you don't have to change. I've been hoping someone will love you, let me go. Someone will love you, let me go. I've been hoping someone will love you, let me go. 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 Been hoping somebody loves you in the ways I couldn't. Somebody's taking care of all of the mess I made. Someone you don't have to change. I've been hoping someone will love you, let me go.
You with the sad eyes. Don't be discouraged, oh I realize it's hard to take courage in a world full of people. You can lose sight of it all. The darkness inside you can make you feel so small. Show me a smile then. Don't be unhappy. Can't remember when last saw you laughing. This world makes you crazy, and you've taken all you can bear. Just call me up, 'cause I will always be there. And I see your true colors shining through. I see your true colors. That's why I love you.
So don't be afraid to let them show your true colors. True colors are beautiful.
I see your true colors shine.
Hi guys, thank you for joining us in the Suicide Prevention Talk series. My name is Johnson. I will be your moderator today. I'm a counseling student from University of Malaya and a volunteer at SkyB. SkyB is an online psychologist matching platform. It provides various types of mental health and support system services, include individual therapy, marriage and couple therapy, group therapy, psychological assessment, and corporate counseling. You can check out our website at myskyb.com to find out more. So, suicide, a dreadful word that I believe not many people were willing to talk about it. However, according to the news report from the Star, a whopping 468 suicide cases were reported to the police in the first 5 months of the year. That is equivalent to an average of 3 precious lives being taken away by suicide in every single day from January to May this year. This terrifying number are showing to us Malaysia in desperation, and this increasing number of them choosing suicide to get themselves out of this desperation. So, in line with Suicide Prevention Awareness Month, SkyB organized a suicide prevention talk series to help you understand the importance of suicide prevention. The talk series is inclusive of 3 different topics. That is community care that we are going to talk about today, mental health care that is happening on the 4th of September, and grief after loss by suicide on the 11th of September. We are delighted to have Ling, a counseling student from Monash University, Malaysia, and a counseling intern at SkyB, to share with us her insight of the different topics related to suicide prevention. So let's invite our speaker to the line. Ling?
Thank you, Johnson, for the introduction. So let me share screen now. Okay. Hopefully everyone can see, and I will be presenting. All right, so hi guys. As Johnson mentioned, my name is Ling. I'm a counselor intern at SkyB. I am from Monash University, Malaysia, and today I will be talking about suicide prevention and how we as a community can do our part. So the contents that I will be covering today would be the background, what's happening, what's going on in Malaysia in the middle of the pandemic, what's the suicide statistics, and next we're going to talk about understanding suicide. We're going to understand more what causes or the risk factors of influencing suicide. Next, we will be addressing the myths regarding suicide and debunk them with facts, as well as how you, as a member of society, of your community, how can you help? So, what's happening in Malaysia during the pandemic? So, I gathered these headlines here from recent months, and as you can see, as Johnson have mentioned, for the past first 5 months in 2021, Malaysia is already recording 3 daily suicide cases. And this is a very drastic number compared to 2020, when we have 600 plus cases, as well as 2019, 600 plus cases as well. Yeah, so like with that drastic number, we are also seeing a rise in a number of calls to helplines amid the COVID-19 pandemic. This is because during the pandemic, when we are under lockdown, a lot of us are losing jobs, or we're facing job insecurity. We lost what was used to be normal to us. We lost even loved ones to the pandemic, to the virus, and a lot of things just feel really bleak, hopeless, unsafe. Yeah, and so this is where we really need to address preventive measures regarding suicide and protecting everyone in their livelihoods. And not only that, even in this article, it stated that are Malaysian women facing an increased risk of suicide? this is in relation to the rising cases of domestic violence that we're facing. Yeah. And yeah, as you can see, it's not just suicide. We are also facing an economy crisis. We're facing health crisis. All the more we need to talk about it. Yeah, about what we can do. Okay.
Yeah, Li, just a quick question. We have seen so many suicide cases in Malaysia recently, but why do they get into this solution for them to get out?
Okay, so when we talk about what's going on, what's causing all this, we also got to understand what goes on in the minds of people who are feeling suicidal. So in order to understand that, I will illustrate an analogy using a burning house. Okay, so before we go on any further, before I show you the image that is possibly triggering, I would also like to put a disclaimer, before we head on any further. Yeah, because as we further on talk about suicide, it's going to be a sensitive as well as overwhelming topic. Even when I talk about the headlines, there's already rising feeling of anxiety, hopelessness. And so if you're feeling any of these, if you're feeling overwhelmed, if you need to take a step back, feel free to refer to the hotlines in the comments as a disclaimer. Yeah. Make sure that you are not just physically safe, but also emotionally safe. And if you need to take a pause, you can pause here. And later on after the talk, there's going to be a recording up. So you can refer to that by the end and possibly maybe skip some parts that might be triggering. So don't worry, and let's move on forward. So this is a burning house. And for someone who is feeling suicidal, you can imagine this. Imagine that you are on the second floor of the burning house. You are surrounded by flames. There seems to be no other way out, no way down the stairs. And the only way out is through that window. And so oftentimes people who are feeling suicidal, who are overwhelmed by suicidal thoughts, and who attempt suicide, they usually feel that way. They feel like they have no other option. And in order to escape the pain, escape the suffering that they're facing, that's the only way out, which is suicide. And so, yeah, like you can see how this is such a dire situation. And if people in a burning house are given grace to what's happening to them, we should give the same grace as well to people who are struggling with suicide. And so with the burning house, so in terms of suicide, it is in line with the interpersonal theory of suicide. This Venn diagram, it is coined by Dr. Thomas Joyner. So in this diagram, he posits that it is through an overlap of multiple factors that transpires the desire for suicide as well as suicide attempts. The factors on their own may not necessarily lead to suicide, but the combination of it increases the risk for suicide. So the first factor is thwarted belongingness, which is obstacles that people face or the difficulties that they face in order to feel a sense of belonging, a sense of connection with other people, as well as access to resources and social networking. So when they are feeling alone, yeah, oftentimes when people live in solitude, again, it might not necessarily mean that they're suicidal. If they're living alone, but they have access to support and they have access to care, yeah, then they do not necessarily think about suicide. However, if they are feeling alone combined with perceived burdensomeness, which is the thoughts of, feeling like I am a burden I am troubling others, I am not worthy of help, then that's where suicide thoughts can come about. And combined with the capability for suicide, the risk gets higher, and that's where suicide attempts can occur. So next, when we're talking about the thoughts earlier, you can consider that as sort of like the fire of the burning house. And what fuels the fire is these risk factors. I have 11 risk factors, and I group them under thwarted belongingness as well as capability for suicide. So the first risk factor is knowing someone who died by suicide, social isolation, mental disorders, stresses that challenge traditional male roles, lack of access to behavioral health care, chronic disease and disability, prejudice and discrimination, as well as historical trauma. And now, all of this, as you can see, it might hinder or it might give difficulty for someone to feeling belonging to the community, maybe connection, because in the midst of the pandemic, when we know someone who died of suicide, we are losing that sense of connection with our loved one, someone important to us, and that can increase the risk of us, feeling vulnerable, and it might lead to suicide. And social isolation during the lockdown, we're not really freely able to go out. We're stuck at home, and if we do not have means to social support, if we're not able to contact anyone, that can really increase the risk of suicide. And with the increase of social isolation, there is also an increase of mental health issues and worsening of mental disorders. And not only that, when it comes to stressors that challenge traditional male roles, so remember the headline that we mentioned about Malaysian women facing a higher risk for suicide? So that's kind of in relation, because when it comes to traditional male roles, males are often seen as sole breadwinner to the family. They are usually the ones that provide food, shelter, money, everything to the table, while the spouse, the wife, is usually in charge of housekeeping, of taking care of the children, and may not necessarily earn their own income. All the income mostly relies on the husband to provide. So during the pandemic, when the husband loses a job, when the husband might be facing more stress, and what if the husband, we've lost them to COVID-19? This is where tension in marriage can occur if the stress wasn't managed. This can lead to domestic violence. And if the women are feeling isolated, are feeling unsafe in their own homes, and if they lack the necessary support to take care of their family, this can also increase the risk for suicide. And so another part is the capability for suicide. There's 3 of them. Prior suicide attempts. So people who have attempted before may have a better idea of what might work. And if they continue to feel vulnerable, if they do not have the right care and emotional support, then prior suicide attempts can be a risk factor. Misuse and abuse of alcohol or other drugs. So sometimes, people misuse all these to either escape from the pain or to really attempt suicide. And yeah, you can see this can really increase the risk when you are intoxicated, when it affects your ability to make rational decisions. Yeah, as well as access to lethal means. So access to lethal means can mean having the means to carry out suicide or endanger your own life. So these are the risk factors that you really have to watch out for. And so after we talk about what it's like and what increases the risk, we can then touch on the 6 suicide myths and debunk them with facts. I found these in the World Health Organization website. And let's see. So the first myth is once someone is suicidal, he or she will remain suicidal, which is not true. Because in fact, heightened suicide risk is often short-term and situation-specific. While suicide thoughts may return, they are not permanent. And even if an individual has suicidal thoughts or they have prior attempts, they still have hope for recovery and they are able to go on and live a long life. Second myth is talking about suicide is a bad idea and can be interpreted as encouragement. Again, not true, because given the widespread stigma of suicide, most people do not really know who to talk to about suicide. So rather than encouraging the behavior itself, talking about it actually gives the individual other options or the time to rethink their decision, thereby giving us a higher chance to prevent suicide. So start talking about it, guys. Like this topic. And the third one, the myth is only people with mental disorders are suicidal. Again, that's not true because suicidal behavior, they indicate deep unhappiness, not necessarily mental disorder. Mental disorder can be a risk factor, but it's not the cause to suicidal behavior. So many people living with mental disorders, they're not necessarily affected by suicidal behavior, and not all people who take their own lives have a mental disorder. So whether you have it or not, you can be at risk at suicide. It's just that people with mental disorders might have a higher risk, but it doesn't mean that they are suicidal. So myth number 4, most suicides happen suddenly without warning. Well, there are some that might occur without warning, but majority of them have been preceded by warning signs, whether it be verbal or behavioral. So it is important to understand what the warning signs are and to look out for them. I will be addressing the warning signs later on, so stay for a bit and we'll address that later. As for number 5, the myth is someone who is suicidal is determined to die. Not true. On the contrary, suicidal people are often ambivalent. They're often not sure whether they want to live or they want to die. Some might act impulsively, they might drink pesticides, and then the effects might be slower and they might die a few days later. But even in that short window of time, they might actually change their mind. They might want to live on if it's not for this pain and suffering that they have, and if they have the support. So access to emotional support at the right time can prevent suicide. And the last one, people who talk about suicide do not mean to do it. So oftentimes, when people want to talk about suicide, there are some who are very unhelpful and say that, oh, they're attention seeking. But no, that statement can be quite stigmatizing. And people who actually talk about it may be reaching out for help or support. It's not that they want to seek attention. Even if they do, it is a cry for help. They need your help. Because a significant number of people, when they think about suicide, they are experiencing anxiety, depression, hopelessness, and they might at that moment feel like they have no other option. Just like that burning house, where you think that the window is your only option. But if we are able to talk about it, if we are able to give them our listening ear, then perhaps we can increase our chances in preventing it.
Yeah, Lee, I do come across some of my friends right there that they just look like a little bit depressed. They're not very happy, especially during this pandemic moment. But how do we exactly know if they would need our help?
Oh, okay. So in this case, some people, they might have expressed what they're going through with you, especially it might be a personal matter. And from there, I will touch more on in the later slides. As a friend, a family member, whether you're a partner, teacher, professional, any role that you want to, any role in the community that you have. Yeah, so how can you be able to help your loved one or someone you know, someone nearest to you? There are, when it comes to risk, there are protective factors. We can address factors that can help increase our chance in mitigating suicide. And so the 5 ones are effective behavioral health care, self-esteem and a sense of purpose or meaning in life, life skills, connectedness to individuals, family, community, social institutions, like your school, workplace, any place that has more social interaction, as well as cultural, religious, personal beliefs that discourage suicide. So in terms of protective factors, as you can see here, let me reiterate some of them. Effective behavioral health care, it does not necessarily mean just counseling or psychiatric help. Behavioral health care also includes doctors, clinicians, fitness trainers, nutritionists, any health professional that can help you assess your needs for health and determine like what's the best behaviors, habits, and the lifestyle development that you can do in order to keep yourself healthy. And self-esteem and a sense of purpose, with high or adequate self-esteem, when you have a sense of direction in life, that can really help you keep going. And for life skills can be problem-solving skills. It can be communication skills. It can be any skills that can basically help you get by in life, as well as maybe securing jobs, any other daily functioning that you have. And as you can see, if you notice, all these 5 skills, they can be cultivated on our own, but only to a certain extent, because all of this, I don't know if you noticed, they do involve community outside other support from other people. So for, let's say, effective behavioral health care, when you see your doctor, when you see your trainer, nutritionist, when you see your counselor, it's already an interpersonal relationship with them. It's already, there's some form of connection to them. Self-esteem, we can build our self-esteem through activities that we like to do, activities that can take care of ourselves, like self-care, and we can cultivate our passion for hobbies and such. But even through that, we might need other people's opinions. We might need their feedback. We might also need their reminders of how much they mean to us and such. And so even from there, even when building ourselves up, we might need a little help and support from others. Life skills. So in life skills, we can watch YouTube tutorials, we can Google up, we can ask our teacher or lecturer, how do we build these life skills? Even those require other people to help us. Yeah. So all of these show that we're not really alone in this. And later on, besides the factors, we can possibly then look at the intervention, specifically what we can do. So this is the intervention pyramid. As you can see here, it is a hierarchy of support of what the community can do in order to build up to more focused, more specialized, more more training for specific issues. And from the bottom here, as we can see, advocacy for good humanitarian practice, advocacy for basic needs, for human dignity, for good policies to protect our citizens. Those are the most basic, and they allow for us to strengthen our community and family supports. So with advocacy and being able to strengthen our community, we can then able to assess what needs we need to meet, what we can do to protect people from disease, famine, suicide. And with the support, we can then train people to provide more focused psychosocial support. This is where a bit of training starts. This is where lay people can gather a bit of training, but not necessarily very specialized training, so that we can bridge communities to the right support. And then with further training, we can then reach to clinical services like a mental health care or mental health professionals. And yeah, as you can see, we really need to play our part as a member of the community to be able to build and contribute to better services.
Yeah, I do agree that the first two part where community helps, right? I remember a few months ago that there is a story of mine that I just want to share with you. My girlfriend actually diagnosed with COVID-19, but luckily that time is not the Delta variant is not so serious. But she did went to the confinement center and then for quarantine. She was taken away by ambulance lah, and then later on she actually develops kind of a trauma to those ambulance sirens and the flashes of the lights from the ambulance, right? But that's exactly the point where I see how social network and those support groups actually helps, right? Because during the time where she will like become very anxious whenever she hear those sirens, then when I'm around, I'm giving her support, she will eventually cool down. And then also her mates during quarantine that time, there's few of them, they remain in contact. They WhatsApp each other, they call each other. So I can see how like community plays an important role. And then to be honest, I don't think we need any training to do so because like me and her mates in the quarantine center, they don't really, they are not really like the frontliner or any psychologist or whatnot. But then just by being present itself is already very helpful. I can see from my girlfriend example. But I believe like the top two, the above two, where the trained personnel is involved, that will be something more serious case, I think.
Yeah, thank you for sharing, Johnson. And yeah, I'm also glad to hear that you're able to support your girlfriend there. Hope she's doing all right and well. And yeah, you bring up a good point that even for lay people, even if they don't have specialized training, they can do their part in providing basic support of a listening ear and such. And it also reminds me, remember the burning house? So when we see someone, when we see someone's house on fire, or when we ourselves have a house that's on fire, actually, we actually do call for help. And who do we call? Firemen. Like even the firemen that came to help us is also requiring a team of firemen. It's not necessarily one fireman show. Yeah, so it's pretty evident that whether it's a burning house or whether it's someone who needs an emergency service when they're facing a suicidal crisis, that support is very much needed, and you are not alone, and help is possible. Yeah, so all the more the role of community is really important. And now, yes, as you mentioned, that they might not necessarily need the training. However, as individual of the community, if you want to be able to do better and to be able to help better and maybe gain a bit of more confidence in handling a suicide crisis. So we can then consider PFA, psychological first aid. And you can see here that it is up here in focused psychosocial support. Okay, so psychological first aid is pretty much like our normal physical first aid from St. John. Yeah, it is an intervention. It is a response to crisis, and anyone can do it. It's best to go for training. Disclaimer again, this talk is for sharing, but it's not necessarily mean that after you walk away, you are immediately trained for psychological first aid. It's just not true. If you're interested and if you need further training on psychological first aid, I could suggest maybe searching up online for courses, or maybe volunteer in departments that handles crisis responses. From there, and then maybe you can have further training. But again, as a reminder, even if you're not trained, do not panic. You can still help out and you can still do your role. Just like when it comes to a disaster, when you have a broken leg, when you have an injured wound, you might not be trained in the physical first aid, but you know how to call 999. You know how to call the ambulance. And so same thing applies here. If you feel that there's a high risk, you can call the right hotlines, and you're not alone on this. So let's further talk about what is PFA and what it's not. PFA, again, like I mentioned, is an intervention response to crisis and disasters. It is to stabilize survivors, ensure their safety, as well as assess their needs. However, what is not, it is not just administered by mental health professionals. Like I mentioned, anyone can be trained and anyone can learn to do this. And PFA is also not on-site therapy. This is because when it comes to therapy is a more longer ongoing process of looking into and exploring what happened possibly in your past or what's happening now. And when someone is in the middle of a crisis, they are usually so overwhelmed that they're not in the right mind to really think about any psychoanalysis or any further exploration on their psychological issues. This is because, at the time their safety is at risk. They are more worried about their safety more so than unpacking any emotional baggage that they have. And if you were to provide therapy in the middle of crisis, there are research that shows that they are more likely to be re-traumatized, and it's just not helpful in the long run. So if it's a crisis, PFA is the best way to go so that we can ensure their safety psychologically and physically. Okay. And so the 3 steps to PFA is to look, listen, and think. Just remember the 3L: look, listen, and think. So what is it we're looking for? And this is where I will talk about the warning signs. The warning signs here for anyone who might be feeling suicidal are being sad or moody, sudden calmness, withdrawing from others, changes in personality, appearance, sleep pattern, showing self-harmful behavior, experiencing recent trauma or crisis, being in a state of deep despair, making preparations for suicide, as well as threatening suicide. And as you can see here, some of these changes are really obvious, like being sad or moody, withdrawing from others, changes, harmful behavior, recent crisis, talking about wanting to die. But this sudden calmness, though, is something that you really have to take note, because oftentimes when you're going through such deep stress and then they suddenly become calm, it does not necessarily mean that they have been feeling better. It could mean that they find relief in planning out the suicide, that instead of them recovering, they're actually planning to carry out the attempt. And so please look out for your friends if they have a sudden change, and like if they have sudden whether it be deep distress or just like very odd calmness, please check up on them. Okay. And another thing to look for besides warning signs is also situation, which is stressful events that can trigger a suicidal crisis in a vulnerable person. So early on, we talk about risk factors, which is factors that can increase the probability of feeling suicidal. For situation, they are more specific to very stressful events. We have end of a relationship or marriage, or a death of a loved one. We have an arrest, as well as serious financial problems. And looking back right now, referring to COVID-19 pandemic, when it comes to lockdown, what we're mostly facing is either the death of a loved one or serious financial problems. So yeah, if you know of anyone who's going through tough times right now and they need support, please look out for them. Second part, after you look out for the warning signs and you know that something is up, this is where you listen to them. So I came up with 3 acronyms similar to the ACE card. Yeah, you can think of when it's time for you to listen, you pull out that ACE card. And the first one, A, is ask your buddy. Have the courage to ask the question, but also stay calm. If you are in distress, the person is in distress, you're going to be in the cycle of distress. And that will be very difficult in helping the person as well as even yourself. So stay calm. And also ask the question directly. Are you thinking of killing yourself? By asking, we can then open up the opportunity to talk about, to let them share. And this is where you care for your buddy. Calmly control the situation, but do not use force, and ensure that you guys are safe. Again, both emotionally as well as physically. Actively listen to show understanding and produce some relief for the person, as well as remove any means that can be used to self-harm. Next, when the risk is really high, or they need support in making appointments, then never leave your buddy alone. You can escort them to the right service if needed. And if the risk is really high, when it comes to a life-threatening situation, please call an ambulance or a bomba or anyone that can help. So when it comes to asking and the caring part, as an individual, what we can do is provide active listening. And active listening plays a really big role here in PFA. The do's are, first of all, being non-judgmental, and again, keep calm. Being non-judgmental means not expressing your judgment or opinion on what the person says or intends to do. Because when we offer our opinion on their intention, when they feel judged, they can feel that they have to defend their intentions. They might feel like what they did might be wrong. And so in order to show that you're here for them, in order to show that right now it's about them, so you can be non-judgmental. You can quiet your own opinions and listen to them and really understand how they feel. And by listening to them, you hold space for them. Make sure that it's not just you listening by your ears, but also body-wise, show that you are open to listening. Ensure that the environment is safe, is quiet, is private enough for them to share, and let them talk about their experiences. And yep, by listening patiently and actively as in showing body language of safety, showing them that you are really attending to them, like nodding your head, eye contact, so and so. You can then let them know that you are open to listening, and they can then talk more openly as well as honestly. If you guys are able to talk openly and honestly, then you're able to assess better on what the person really needs. Otherwise, if the person is hesitant or they don't reveal as much, you might not know what they really are, what goes on with them and what they really need. And the fourth one, as you're listening to them, you can also express love and care compassionately to them. You can gently let them know that, hey, I noticed that you have been going through a lot of things, or maybe you seem stressed, and I worry for you. So how can I help? Something along those lines to show that they are not alone, that you care for them, and that you are here and available for help. Number 5 as well, take them seriously. Just like the myth that we talked about, when they are actually confiding you about suicide, they're actually asking for help. It could be a cry for help. And so even if they seem like, oh, don't worry about it, it's just suicidal thoughts, I don't have any plan. Even if it's just thoughts, or they have a high risk plan already, take them seriously. Yeah. Don'ts to active listening would be the opposite of taking them seriously. Yeah, so please do not downplay or dismiss the severity of the problem. You have to take them seriously, because a lot of times when people are expressing or confiding in us, and if we ourselves are feeling panicky or not able to hear them out, we might either accidentally or unintentionally dismiss them or downplay them. We might say statements like, oh, get over it, or telling them that, compare to others, you're not as bad, others have it worse. Those are really not helpful statements, because it is, you can imagine that when someone has a broken leg or a sprained ankle, both are still pain and both need medical attention. You don't tell someone with sprained ankle, oh, don't worry about it, you'll get over it, right? So same goes with suicide. Whether it's suicidal thoughts or a suicidal plan, they are still going through some form of pain. And this is where you really need to offer them support. Even when you offer them support, number 2, do not try to fix their problem. Pretty ironic, because right now we're talking about wanting to help, wanting to do something. But what I mean by do not try to fix their problem is when you're talking with them and when you hear them out, it is best to ask them to get to know what they think is helpful for them, because our experience and their experience is not the same, and they're the best ones to know what would really work for them. If we are giving them unsolicited advice, then we are essentially taking the spotlight away from their problem, again, downplaying or dismissing them. And then from there, they might find it difficult to ask for help, because oftentimes when we give advice as well, it can either be really unhelpful, or it can kind of unconsciously send them the message that they're not capable of handling it on their own. It's not true. From listening and giving them emotional support, we can then help them get back on their feet and support them and show that they can handle it and they know what's best for themselves. Autonomy is important. Third one is do not argue with what they got going and how it would affect their family, because these statements are really guilt tripping. Yeah, again, it takes the spotlight away from their problems to external factors, as if externally is more important than their pain. And we do not want to do that. That is not active listening. So when you're listening to someone, don't argue with them on what's right or what's wrong, because what's important is hearing out their pain. When you have a sprained ankle, it's not like you're gonna say, "Oh, sprained ankle is wrong," or, you know, or it's something morally right. Sprained ankles don't really have any moral values. So, what more suicide, right? It's still pain and it's still something to hear out. Fourth one is do not ignore warning signs. Again, whether it's a thought or whether it's a plan, any change at all, please take them seriously and hear them out. Yeah, like check in with them. If it's really nothing much, but then they can handle it, okay. But it also opens an opportunity for them to ask for help, if anything. Fifth, do not handle it on your own. Like I mentioned, the firemen and community support, just know again that you're not alone. If you aren't sure how to help, you can always ask someone else. You can always refer to services and ask them, what can you do at the moment? Okay. So questions that you can ask when it comes to risk assessment. First is, do you have a plan to take your own life? Or have you thought about how you would do it? Do you have the means or materials available? Have you set a time? And if all of this answer to yes and has dived down to the specifics, then you ask them, have you ever attempted suicide before? And what happened then? All of these questions are quite direct, but they are very crucial in assessing the risk. Because if they have a definite plan, if the means are available, and the time is set, then consider them high risk and possibly get emergency services or arrange an appointment. Do not leave a person if you feel that they are high risk, even for a moment, because they might in the state of depression or anxiety, when they're not thinking as clearly, they might resort to doing something, and from there it might be too late. So please stay with them. Keep talking to the person, stay with him or her, or again, arrange someone they trust and feel comfortable with to stay with them if you're not able to do it. Okay? Again, this part, ask for help and make sure that the person is someone they trust and feel comfortable. Emotional safety, guys, we have to make sure of that. And also remember to remove any firearms. And if the person in crisis has taken some form of life-threatening action, this is where you really, really, really need to call ambulance or even the bomba. And for the hospital, you can accompany them to the psychiatric ward for assessment and further intervention. For those who might be, at the maybe high-rise building, something really dangerous, like maybe even at the bridge or something, this is where you call the bomba for help. Okay. And yeah, as we talk about listening, we assess their risk. We have link. So linking to help, whether it be a high risk link or a low risk link, this is where we help address their basic needs and know where to assess these services. We help create a safety plan and also connect them with loved ones and social support. Again, bringing them back to the community, showing that, that they have help and they're not alone. Not only that, after they get the necessary help, once things have calmed down, this crisis has calmed down, remember to follow up and check on the person's well-being. I compiled these two lists of contacts. Feel free to either screenshot or take notes of these contacts, in case there's any emergency and you know where to go to. For high risk, you can consider calling for hospitals. For emergency wards in Malaysia so far, only public hospitals can accept check-ins. So yeah, please refer to your local public hospital, call 999. And yeah, also refer to your bomba if it involves any safety issues, high-rise buildings, such and such. For hotlines, You can call Befrienders, Casa Italian, Women's Aid Organization. I'm just compiling a rough list based in Selangor, but then if you are in another state like Penang, Malacca, and such, then feel free to compile your own list and check your local services. For low risk, when things are calmed down or when the person is just having thoughts, but they are able to handle and they just need access to basic services, you can consider these lists like support groups, food banks, hospitals. You can arrange appointments for either private or public hospitals. You can refer to crisis counseling services, and you can even turn to apps, especially when, with the white flag movement, they have created more accessibility to resources. Yeah. You can screenshot this if you'd like, or come back, take a pause or anything. Or if you request for slides, you're welcome to do so as well. And this is food bank apps, something just to highlight that after talking about what goes on with suicide and what we can do during a crisis, I kind of want to end on a note here that even in this state of despair, of hopelessness, in political turmoil, there is some hope for the community. And during the crisis, it's so nice and lovely to see everyone getting together, under the white flag movement. We come up with food banks. There are people, again, coming up apps, not just for services to food, but also access to mental health services. So mental health, initially, when we talk about counseling or appointments to clinical psychologists or psychiatrists, it was traditionally face-to-face. But now we have online availability. We are able to cross states through online. Not physically, guys, we're still under lockdown, stay safe. And we have online counseling, and this really makes everything easier and safer, especially when we are trying to avoid getting contracted with COVID-19. So, I like to end this here saying that there is hope. And I hope this talk is helpful for you. I hope the theories that I shared and the steps that I've shared, I hope that helps. And of course, after knowing the services and everything, remember to follow up with the people. So you can leave a message, send a text, or give them a call. And by offering them further help and see what else they need, you can continue to increase their feelings of connectedness and share your ongoing support. Yeah, there is evidence that that simple form of reaching out can reduce their risk of suicide. See, a small effort counts in a long way. And that's it for my talk. So I am open the floor to questions.
All right, thank you, Ling. That was a very informative presentation, and your sharing is indeed guiding us through the steps to prevent suicide cases around us. And you also provide us with information about available resources in our community, the high risk and low risk list. And I personally like the 3 L's, that is look, listen, and link. That is very easy to remember, which gives us an idea like how to actually help those around us that is in need. So once again, thank you, Ling, for your sharing. Now let's take a look at the questions from our audience. And let me see. Yeah, we do have a few questions here, Ling. We start with the first one. This sounds to be quite serious here. Like, what can I do as a friend when she shows me a cut on her wrist?
Okay. So when someone shows that, okay. First, again, let's remember back on PFA. Okay. So from there, we remember the look out listen and think. So look out. Yeah, we can see that there is a self-harming behavior. However, when it comes to self-harm, it does not necessarily, again, mean to suicide, because when it comes to self-harm, there's actually two categories: self-harm, non-suicidal self-harm, as well as suicidal self-harm. So first you have to assess that by, again, listen. We can, from listening, we provide active listening. We ask them directly, but as well as gently, checking in with them, like, see, you have a cut, like, are you okay? But if it's a fresh cut, okay, do not panic first, but know that you have to prioritize their physical safety. If they are bleeding heavily as well, you need to refer to an ambulance, because that's considered high risk. Yeah, or if you have first aid, you can administer that first and then call the ambulance. But if it's something like an old injury, and they might be sharing it with you at that, so you can then proceed to the asking, the caring, what's going on, checking to see if they are injuring themselves due to something going on in their life, some pain, some issue, or is it leading up to something that they are attempting, like suicide. And then from there, you can show your care, your concern, and yeah, follow that ACE, as well as linking them to support. So the 3 L's and the ACE, remember that.
Yeah, I do agree. When it come with like crisis like this, we don't panic first. Remember what the PFA is about. All right. Yeah. Before we go move on to the second question, I just want to encourage more questions. If let's say you have any doubt, you can just type in the chat in Facebook, or if you would like to remain anonymous, you can use the Slido. Right. Let's move on to the second question here. We have, if my friend is too dependent on me and I feel overwhelmed with all the things she shared, what should I do? I think it's like some of like the individual is too clingy to the helper, cases like this.
Okay, so let's say you have someone who's really dependent on you, and if you are feeling overwhelmed, first off, self-care. You have to ensure that you yourself is in the right state of mind to be able to offer support. Because again, like I mentioned before, if you are in distress and the person in distress, it's going to be a circle of distress, because when you are overwhelmed, it's very hard to hear the person out what they need. And it's also, it can be very exhausting as well. Yeah, if you're a caregiver, or if you're someone who the person relies on a lot, it can come to a point of burnout even. And so if you feel like you can't really help them, but you can see that they're in distress, you can always refer to them, link to them for help. And it's kind of synonymous to the airplane safety, in which when people tell you to put on the oxygen mask, they didn't really say put on others first. They tell you to put on your own oxygen mask first. So remember to take care of yourself. Know that whether you are well and available for help, then you can decide whether you want to help them or not. And even if you do want to, but you're not able to, then you can refer them resources like those hotlines and all that, or you can even accompany them to go find the resource. Yeah, like making appointment or looking for someone else for help. Yeah, that can, those are things to consider. So please take care of yourself first.
Right. Yeah, it is very true that if we are not in good shape, then maybe we couldn't really like provide lending our hand to help others. Great. The next question here we have, what if the person does not want me to ask for help from professionals? What should I do? Yeah, I think this is a question I have as well, because most of the time people they are just not ready to to seek for others' help, some strangers' help. They just want to talk to you. What should we do in cases like this?
Okay. So when it comes to people who do not want to seek help from professionals, maybe they're more comfortable with you. It shows that they trust you more maybe, and they feel safe with you. But there might be obstacles to seeking professional help. They might feel uncertain, they might feel scared, they might feel distrustful and not sure what will happen when they see someone professional. Because when it comes to mental health services, a lot of times there's a stigma to it as well. Yeah, people think that you have to be crazy and then you have to seek mental health support, which is not true, because even non-disorder issues like career issues, relationship issues, maybe even exploring your self-identity and such, if you need a neutral, safe space, you can look for counselors and all. You don't have to wait until you get serious disorders to seek professional help. So perhaps once you ensure that the person is safe, you can then ask them, what's stopping you from seeking professional help, or is there something that's stopping you?
Yeah, I do agree that like the PFA pyramid that you show, you go step by step from bottom to top. Just do whatever you can as a friend, as a family member, then slowly guide them to the more professional help. Okay, cool. Next one, I think this is more related to the myth and the facts, that part that you share. The question goes like, does only depression or schizophrenia leads to suicide?
Yeah, it is in relation to the myth earlier, which is that only people with mental disorders have suicidal behavior. Gonna debunk again. It's not true. So again, mental disorders is a risk factor. It can be correlation, but it's not causation. It's just correlate. It may be a link, but it does not necessarily mean mental disorders cause suicide or lead to suicide. So if you have depression or schizophrenia, and if you have the right support, and depending as well on the severity of the disorder, if you have adequate support, then it may not necessarily lead to suicide. Yeah. Some people, they might be mildly depressed, but they might not have plans for suicide, or they might not have thoughts, they might be just depressed. And from there, you just need to be able to assess the risk. Again, ask questions, show that you care, and it does not necessarily mean that they are suicidal.
Right. Yeah, I just want to add on, like, because we earlier on we learned about the 3Ls and the ACE acronyms. But if let's say those like really depressive individual, does this step still applicable to help them in the family and friends kind of level?
Yeah, PFA, again, it can be administered by anyone non-professional, and it can be administered to your own family members, just like physical first aid, right? And so it is applicable. And if you remember, to say you have your family member or your loved one fighting to you that you're feeling suicidal, and when again you can see remember the pyramid strengthening. Family support is really important, and so from there you can then, when they confide to you, you can remember again the 3Ls. Remember to look out for the signs, remember to listen, hear them out, show them non-judgment, and then we can then link them to the appropriate services. And sometimes they might not talk about it, but then the behaviors show. So it is best to check on them. So like say maybe a friend of yours, they purposely reduce the time of gathering, or they chat with you less, and you suddenly hear that they're in a crisis situation. Yeah, those are the signs to look out for, as well as situations. And then from there, you can open up the invitation and check in on them. Hey, I noticed that there are some changes. Is there anything going on? Or, hey, I heard that something went on with you. Is there anything I can help with? Something like that.
Right. I think it is very important for us to be very observant to people around us, especially those that we care, that we love. And then practicing the 3 Ls could be something a life-changing kind of action to take. All right, the next question we have here is how do I know if my friend is trying to suicide or experiencing depression? Because some of them maybe don't want to let people know about this, scare others, judge them. How do we know if they are experiencing those suicidal thoughts or experiencing depression?
So that's a good question. Yeah, it's friends face. And again, the first thing we got to do is look out for the signs. And like, again, if your friend is showing any behavioral changes, maybe more withdrawn, maybe less optimistic than before, less active, check in on them. Yeah, whether it be text or call. And even some friends, remember what I said when they have sudden calmness. Yeah, if they are going through some stress and they suddenly became calm and they were like started giving out things to people, that's where you really gotta ask. And again, like what I mentioned in ACE, you ask them directly. My father would always say, you never ask, you never know. So it is best to ask rather than assume. And yeah, and even sometimes, right, if it's not looking out, sometimes you have to trust your gut feeling. Yeah. Even if your friend seem very dismissive themselves, like, it's nothing, I'm doing okay. Sometimes you got to trust your gut. And if you seem like that's not a normal response, or that seems a little odd, you can ask them. But then if they seem unwilling to share further, if they are quite reluctant, that is where maybe you can step back, give them some space. Maybe they're not ready to share yet, and you can just let them know that, hey, if you need any further help, I'm here. Know that I am here, okay? Kind of letting them know that, okay, you're gonna give them some space, but you're here. Sometimes, like you mentioned, Johnson, that just providing them the presence can really help. Sometimes not saying anything as well can help. Yeah. So that was a good pointer that you did earlier.
Yeah, I agree that being physically like available to them, or even like in the lockdown situation, we can give them a call, things like that will be very helpful. Yeah, the next one, is it the person will experience depression first, only then this will lead to the suicide action? I think you addressed this before, like which one comes first? Does depression lead to suicide?
So yeah, I earlier mentioned again that mental illnesses is a risk factor, but just because you don't have not suicide, just because you don't have mental illnesses, it doesn't mean that you are not vulnerable to stressful situations and suicidal tendencies. Because if you remember the stressful situation, yeah, when people are in a crisis, such as losing a loved one, death of a loved one, or a financial problem, or what was it? Those 4 situations back then. And let me get back a bit. situation. Sorry. Yeah, situation. So if you remember that in these stressful events, even if the person does not have previous history of mental illnesses, they are also vulnerable to a suicidal crisis in these situations when the stress is not managed and if they don't have adequate support. So yeah, it's not necessarily mean that they will have depression first and then lead to suicide. It could be this crisis first, and they might be overwhelmed with stress and they might actually think there's no way out. And yeah, so whether you're not, you might be susceptible if you're not able to, if you're feeling overwhelmed and you do not have adequate support. Yeah.
All right. Yes, the next question we have is rather heavy here. This person asks if our loved one is suicide, and is it our fault that we do not know what to do like earlier?
So yeah, regarding the death of someone we lost through suicide, no, even if when the person is alive and you might have disagreements, you might have missed appointments, it doesn't mean it's your fault. Suicide, it could be influenced by many factors. See earlier the risk factors, there were like 11 of them. And so suicide can be a complex issue, and it could be a buildup to of many issues that we might not know of. Yeah. Okay, and so when someone died by suicide, and if you're plagued by thoughts of, is it my fault? Well, I can't give you a direct answer. It does not mean that it's entirely your fault. In the end, is their choice, you know? And there is heavy grief when faced with this loss. So the best way to face this is, you don't have to blame yourself. Remember to get adequate support. Maybe seek counseling.
Yeah, I agree. Again, that you have mentioned that we need to help ourselves first before we extend our help to others. Similar goes to this case. If you think that what you yourself is in a situation, then perhaps you are the one who really perhaps need more help rather than focusing on how to help others. Yeah, so always help ourselves first. That's the take-home message here. Next one, if there is no sign of mental disorder, but the person just suicide without knowing, is there such a case? I guess this person is asking, is there some cases where we don't see any sign of mental disorder and then suddenly the person committed suicide?
Okay. Yeah, like I mentioned before, there are cases where it might suddenly occur. It could possibly be of many reasons. Maybe like the person did not share. They might seem very optimistic on the outside, but we don't know what's going on internally. And yeah, like it's a, like there are cases like this, but it's quite small. Yeah. And I think I should further reiterate on the previous question as well. Yeah, regarding grief by loss of suicide, that one, we will be addressing it in the third talk. So by September 11th, to the crowd, feel free to check in on that later. And yeah, just know that many things in life we can control, but also not control. A lot of things, like other people's opinions, decisions, even their decision to attempt suicide, it's not within our control. And so from there, being able to know what we can do and what we cannot do can be of relief to people. So feel free to check in on the talk on the 11th, yeah, as well as on the 4th of September to know how to take care of yourself. And yeah, again, in terms of like if a person does not show any sign of suicide but then suddenly became, there are cases, but it's just that they're a minority, and so all the more important that we are able to look out for the signs. Yeah.
Right. Yeah, I think the myth and debunk with fact that part says repeated quite many times that that is actually a correlation, not causation for mental disorders. All right. The next question is that will it consider someone who goes through mental health issue is not in the right mind? For example, symptoms of anger, dwell in sadness, etc. I think it's more like it's symptom of anger and dwelling into sadness is a sign of mental health issue. Do you think so?
It can be a symptom, but in terms of severity as well as diagnosis, as lay people, if we don't assess deeply, we might not know what's the real cause or what's really going on there. So I'm not sure if I'm not in the right mind, but if we're talking about symptoms such as anger and sadness, those you can refer to the DSM-5. It's like a manual in which symptoms for mental illnesses are listed out. And apparently in depression, if you have those listed symptoms for continuous 2 weeks, it might be depression. But in order to get a accurate diagnosis, it is best to see a clinical psychologist. Clinical psychologists and psychiatrists are trained in diagnosing these illnesses. And so if you want to have a more accurate diagnosis, it is best to book an appointment and let them see and assess your situation rather than self-diagnosis, because self-diagnosis, while it can be helpful in identifying the symptoms they have going on, however, if we self-diagnose without proper training, without further assessment, it can be really dangerous. So it is best to check with a professional on this. Yeah. And sometimes, yeah, it's also something I have to reiterate as well. Even if there are these symptoms, it sometimes might not necessarily mean mental illness. It could mean a response to a crisis or a certain situation. And yeah, we can talk further about it when we talk about crisis.
Yeah, I do agree that whenever there is some extraordinary kind of emotion or behavior that we observe from others, from the people around us, we will also have to look into the life situation, where are they, what are they experiencing right now. Because for example, if there's a loss of some loved one, we should have give them some time to to actually experience the sadness for some time, but not so to prolong kind. So if that's the case, I don't think that is something that called out of the mind or whatnot. But as you answering just now, Ling, there's a question came in that he said he thought self-diagnosis is not true. Yeah, self-diagnosis. He said self-diagnosis is not true, where it will be mislead.
Okay. Self-diagnosis being not true. Yeah. Yeah, especially if you're not trained, and also you might have self-bias. Yeah. Sometimes, might not have a full, accurate, objective view of ourselves. And this is where, again, role of community, we need other people to see from another perspective and to check in. And this is why we have professionals. This is why it is best to seek an appointment from a professional to have a more accurate diagnosis. Because self-diagnosis, again, it is good to be able to identify and be, hey, I have this. It could be something, but it does not mean that's the diagnosis, because diagnosis can encompass many symptoms, and we need a more thorough assessment, a more thorough look at what's going on and what could be the cause. And we might have a limit to that if it's our own perspective. So we need a more professional opinion.
Right. Yeah, since we are in the topic of mental illnesses, I just jump into the next question first. We'll come back to that later. Is it normal to have mental illness? A very short, precise questions. What do you think?
I mean, like,
It's pretty common. They actually even say that depression is as common as the cold and flu. And yeah, you can also ask yourself this, is physical illness considered normal? If physical illness is considered normal, mental health is also, their illnesses are quite normal as well, because they are on a milder spectrum. It is a response to the environment around you, a response to a crisis. Yeah, it's normal. And only when it really disrupts your life, it affects your daily functioning. If you're not able to go about independently or interdependently, that's where it might show that the symptoms show that something might be wrong. It's like a signal in your car showing like, oh, you're out of fuel. It's as normal as that. It could be an indication to a more serious or a more underlying problem. And this is where we encourage you to seek help, get a professional opinion, and hopefully then you're able to understand better in what works for you and what needs to be addressed. Yeah.
Yeah, that's correct. There's no normal or not normal in a sense, because yeah, we are human being. We have times where we are very very strong. We're capable to do a lot of things, but sometimes yeah, we do need some help from others as well. Well, Ling, if you need to, thank you for answering so many questions. If you need to take a rest or drink water, please feel free to do so. Yeah.
Thanks for that, Johnson.
Okay.
Yeah, thanks for that.
Because more questions are coming in, I can see the audience is very responsive here. Yeah. Yes, the next question. How to know if a person is in a higher level, higher stress level? What are the symptoms? How can we notice if they are in high stress level?
how can we notice if they have a high stress level?
Again, we also look at not only just their symptoms like moodiness and such, and the changes in like patterns of living, like their sleep, their appetite, but you can also look into physical symptoms. Sometimes these physical symptoms are actually in line with your mental health symptoms. Like if you're stressed, you can actually notice that you might have tense shoulders. Yeah, you might have beating heart. You might feel your state of mind is fogging. There are a lot of physical symptoms related to stress, like aches, pains, trouble sleeping, dizziness, jaw clenching. And sometimes when you sleep, right, and you notice that your jaw might be, or not just sleeping, maybe when you're subconscious, you didn't realize your jaw might be tense. Yeah. Every time we're tense, it might mean that you're stressed. So oftentimes when we are in high stress, this is where we teach people a lot on de-stressing techniques such as deep breathing, relax your body, do something like self-care, such and such. Yeah.
Yeah, there's a lot of symptoms that we can notice if, let's say, we are in a high stress level. If it is when we are able to like calm down and then really listen to ourselves, like inside, then we can be easily notice all these kind of symptoms now. Okay, the next one here is that can mental illness be cured, or we only can learn to cope with it?
Can mental illness be cured? In terms of cure, that one you might need to ask a psychiatrist. So me as a counselor, I am more specialized in non-disordered issues. Yeah, but in terms of cure, I think there's a full, there
may or may not be a full cure, but there are medication, there are interventions, there are healthier lifestyle habits that can help us cope better with our symptoms or possibly recovery. Yeah. That one, if you ever face any symptoms or troubles, it is best to ask a psychiatrist.
Yeah, since we talk about medication, right? There's really a question coming in about medication. He asked if any medication can heal to prevent suicide.
heal to prevent suicide. So far, my knowledge, no, there's no
Medication that you can just directly
address suicide tendencies, because that's there could be a stress response, or it could be a slow build-up until you are overwhelmed by the thoughts of, again, the perceived burdensomeness, thwarted longingness, as well as capability for suicide. However, there are medication for treating
like depression or any symptoms that might hinder your sense of belonging or access to care. And yeah, suicide is not a virus, it's not a bacteria, but it is rather a behavior, a response for the person to escape and stop the pain.
Yeah, it can stabilize.
It can address any depressive feelings, but there's no direct medication to suicide. Yeah.
Yeah, I agree. It is not like a cold or fever where we can address it directly. It's not a symptoms. Rather, it is something behind the action. I would say. Okay, the next one. Someone asked to get the slide for today's talk. Where can I get the slide? Yeah, I think you can actually message our admin, or you can visit our website to see there's an email there, myskype.com. Then you can the admin email as well. You can email us, then we can send it to you. And then the next one, I hear that there's something called prevent suicide plan. Ling, have you come across this prevent suicide plan?
Yeah, a preventive suicide plan. So, what we often refer to as safety plan. Yes, we have such plan. It is a list in which that you note down the triggers that you have, as well as coping skills and resources in order to help you overcome these triggers. And usually, the safety plan we work together with people in suicidal crisis or anyone in crisis, so that when something does happen, they can refer to the list, kind of like their very own first aid kit, but in more of for mental health. And yeah, actually, I got this safety plan here. So when you're calm, and if you feel like you wanted to make your own plan, you're welcome to do so. You can choose a more safe environment, when you're calmer, or you can work together with a counselor or your mental health professional to address some of these. So you can list down the triggers. What are the warning signs? Yeah, any physical symptoms or state of mind that you think are warning signs to the triggers. Then you can list out the useful ways to distract yourself, ways to keep you safe, people that you feel are safe and reach out to, as well as other resources. So, yep, your very own personal mental health first aid.
Yeah, because usually we only come across like the medical box when we think of first aid. Yeah, but there is indeed something for mental health as well. Okay, let's move on to the next one. The question back to mental illness. The person asked, can mental illness be genetic? Meaning, would that be a family kind of trend there?
So, let's see here. Mental illness, in part, yes, it can be genetic. There are research that indicate that they have a genetic influence. Yeah, for example, depression, schizophrenia. But then that's part of the percentage. It's not necessarily a one all be all. It's just like risk factors, right? So if your family member has depression, the following relatives or descendants might have a higher risk, but mental illnesses can also be like linked to many other factors, environmental factors, or like lifestyle factors, many things. And yeah, so when it comes to determining the factors, what we can explore further, it is best to seek professional help so that you can have a better clarity on it. Yeah.
Yeah, I also recall that when we learn psychology, right, there is something called nature and nurture. There is indeed something in biology, but the environment, it plays a very important role as well. The next one is that, well, is a scenario where a mother, he asks how a mother can help her daughter if her daughter always have suicidal thoughts and the daughter is not willing to share what she's experiencing to the mother. How do we do it? How do the mother react to a situation like this?
So yeah, when it comes to more familial situations, where if you know someone close to you, in this case a mother to a daughter, when the daughter is having suicidal thoughts and yet she seems hesitant in sharing, this is where the mother can again refer to the 3 L's. So look up for the signs, and if the mother suspects that yeah, she has suicidal thoughts or have confined, confided to her, then that's where you have to do active listening. Have to ensure that like your daughter is safe, but not only that, also ensure that she is emotionally safe. Does she feel safe with you in talking about it? And if she does not, there is a chance where you might take it personally, but don't have to be, because oftentimes we can seek help elsewhere. People are free to determine what is the best for them, and just merely letting them know that they can have their space, but you're here. Just letting them know your presence here. You are there for their support. That can perhaps build some form of rapport because you let them have their space. Yeah. And not only that, if they're not comfortable talking it with the mother, then the mother can also suggest, again, refer, link, right? If you listen and you see that they're not really willing to talk about it, you can then link them to resources. You can maybe ask them, would they like to arrange an appointment with a counselor? Also let them know that, hey, I am worried, you're my daughter, I really love you. And, but if you need other resources, then perhaps you can make suggestions and not unsolicited advice, because in the end, it is best to have the daughter choose the help that they can get rather than forcing help on them. Because if you force someone, they are less likely to get the help, and they might feel kind of restricted. Yeah.
Yeah, I do agree, because a lot of, if let's say the daughter is like teenager, a lot of teenagers, they just want to do things in their own way. If let's say there's too much forcing, then it will not be turn out to be good situation. Okay, the next one related to ethics, our professional ethics. I believe this person is a frontliner or counselor. If you are a professional and your client has ended his or her life, will it affect you because you failed to stop the individual to attempt suicide?
Just a moment, let me stop sharing. You were asking, sorry?
Oh, the question is, if you are a professional helper and then your client actually ended his or her life, would it affect you because you failed to stop the individuals to attempt suicide?
I would say depending on your relationship with the colleague and how much you know what's in control, what's not, you might be impacted because there's, you lost someone, whether that person is close to you or not. They still play a part in your life, and when they play a part and when they're suddenly gone, there's that sense of loss. And depending on how you cope as well, it might affect your daily functioning. And grief, a lot of times people thought that maybe within a certain period of time, they might be able to overcome grief. But that's not necessarily the case, because grief doesn't have a timeline. And well, if it happens, then give yourself some space, give yourself some time, and especially if if that's for a colleague, right? Someone you work with. As for clients, if you work personally with the client and the client in the end still chose to take their own life, then know that you did the best you can, if you've gone through the safety plan with them, just know that you did your part, and in the end, it's the client's choice. Yeah, it could be of many things, and it might not necessarily be that because of your session that it influences. It might be of many cases, and we might not know. So self-care, and make sure that you have the time and space for yourself to grieve.
Yeah, again, I think the metaphor, the metaphor that you mentioned, the airplane emergency case, we always have to help ourselves first, lah. And then if let's say, unfortunately, our client or coworker, they actually choose the suicide to end their life, then it's something that we need to take care of ourselves, lah. And then in terms of ethicals, I think if let's say there is the necessary we have done the necessary, then should be all right. Like those informed consent and then those disclaimer that we have made earlier. Right. I think it is kind of a lot of questions that you have addressed, Ling. Thank you very much. Shall we go for the last one? Here, I think related to your slide, the hotlines. This person asks, is the hotline you provided is 24 hours? Like if let's say he or she want to call during the midnight, is it okay? Yeah. The list that you have shared earlier.
So for the high risk one, yes, earlier the high risk numbers are 24 hours, like Befrienders, Kasih Talian, and even Women's Aid Organization is 24 hours. So that's why I list them under high risk, so that when crisis happening and you're overwhelmed, you weren't sure, that's a quick list to go to. And yeah, as for the low risk one, those are more maybe they have their own timeline, their own opening hours, and I can slowly refer to that. And yeah, if anyone needs the slides, feel free to email the admin, and we can share that. Yeah.
Yeah, I do agree, because today we can easily access to website. If let's say we have any doubt in terms of those hotline, we can always visit their website and then to see whether there are 24 hours available. All right, I think that's all for the questions. If let's say no more questions coming in, yeah, we do have more questions, but I think Lee has spent a lot of time to address. Thank you for your time. And then right now, yes, I just want to gather some feedback from our audience, because since our audience is very responsive, asking a lot of questions just now, I hope to have some feedback from you guys as well. If let's say you notice, there is a link, a feedback link. It's actually a Google form posted in the comment section. If you have any feedback that you want to give us, Gaibi, then you can write down there. Yeah, on the screen as well, we can see there is a QR code. You can scan and then give us some feedback. Then we know what can we do to share more information to you. What kind of information do you think it will be helpful for you and for the people that you love? Let us know. Then we will prepare necessary and help you as you wish. All right. We take some time to do this form. It's a rather very short one, but while you are doing, I just want to share with you what we have today. Community care is the first topic that we have in the suicide prevention talk series. This series is actually consists of 3 topics. That is community care that we have done today. Mental health care is happening on the 4th of September, and grief after loss by suicide happening on 11th of September. So if you would like to know more information, there's another QR code linked to our Facebook page to gather more information. And if you notice, there is an admin email. If you want to get the slides for today, you can email our admin to get the slides. Yes, I hope this talk will benefit you and the people around us that you love, that you care. And if let's say there is something is out of your ability to help them, remember always do self-help first. If you are not in a good shape, it will not be beneficial to help others. Like Ling say, the airplane emergency metaphor that she put it. We always do self-help first. Okay. Yes, this talk. I think we are close to the end. If you have done the feedback form, thank you very much. If you have not done, please feel free to click on the link and then give us some feedback. Thank you very much again. Thank you, Ling, for your presentation and for your time in answering so many questions that we have from our audience. Okay.
Yeah, thank you for having me.
Yes. All right. So see you guys again on 4th of September and 11th of September, which is on Saturday as well. Same time, 3 p.m. to 5 p.m. We hope to have you again. If you have any more questions, you can email to us anytime. Thank you very much. And yes, the live will continue for a little bit more time. If you need to ask questions, then you can go to our Facebook or you can email us. Thank you.
Your true colors.
True colors are beautiful.
Like a rainbow.
Oh, like a rainbow.
Who can't remember when I saw you laughing?
This world makes you crazy. Taking all you can bear. Just call me up, 'cause I will always be there.
And I see your true colors shining through. I see your true colors. That's why I love you. So don't be afraid. To let them show your true colors.
True colors are beautiful.
Like a rainbow. Like a rainbow.
Mama always told me I should be the light out at sea, shining in the dark when someone's broken, tired and in need. So I'm always the shoulder where anyone can lean. Oh, where do I turn now that I'm sinking into the deep?
Somebody save me. Save me from myself. I can break free from the cards I've been dealt. So good at helping when it's somebody else. Just save me, 'cause I can't save myself.
Save, save, save. Save, save, save. Ooh.
Truth is that I'm hurting, but I'll turn to what I was told. I don't have to carry every burden all on my own. Come now, weary heart, I wanna hear you with every beat. Come now, steely lungs, and be the choir louder than the sea.
Somebody, somebody,
Somebody save me, save me from myself. I can't break free from the cards I've been dealt. So good at helping when it's somebody else. Just save me, 'cause I can't save myself.
I saw you dancing in a crowded room. You look so happy when I'm not with you. But then you saw me, caught you by surprise. A single teardrop falling from your eye. I don't know why I run away. I'll make you cry when I run away. Take me back, 'cause I wanna stay. Save your tears for another. Save your tears for another day. Save your tears for another day.
Met you once under a Pisces moon. I kept my distance 'cause I know that you don't like when I'm with nobody else. I couldn't help it, I put you through hell. I don't know why I run away. Oh boy, I'll make you cry when I run away. But take me back, 'cause I wanna stay. that you can't even have a good time. Everybody look to their left, everybody look to their right. Can you feel that? Yeah, we're paying with love tonight. It's not about the money, money, money. We don't need your money, money, money. We just wanna make the world dance. Forget about the price tag. Ain't about the cha-ching, cha-ching. Ain't about the bubbling, bubbling. Wanna make the world dance. Forget about the price tag. Okay. We need to take it back in time when music made us all unite, and it wasn't low blows and video hoes. Am I the only one getting tired? Why is everybody so obsessed? Money can't buy us happiness. Can we all slow down and enjoy right now? Guarantee we'll be feeling alright. Everybody look to the left, everybody look to their right. Can you feel that? Yeah, we're paying with love tonight. It's not about the money, money, money. We don't need your money, money, money. We just wanna make the world dance. Forget about the price tag. Ain't about the cha-ching, cha-ching. Ain't about the bubbling, bubbling. Wanna make the world dance. Forget about the price tag.
Well, keep the price tag and take the cash back. Just give me six strings and a half stack. And you can keep the cars, leave me the garage. And all I need are keys and guitars. And it's within 30 seconds, I'm leaving to Mars. Yeah, we leaving across these undefeatable odds. It's like this, man, you can't put a price on a life. We do this for the love, so we fight and sacrifice every night. So we ain't gonna stumble and fall, never. Waiting to see us in the sign of defeat. So we gon' keep everyone moving their feet. So bring back the beat, and then everyone sings.
It's not about the money, money, money. We don't need your money, money, money. We just wanna make the world dance. Forget about the price tag. Ain't about the cha-ching, cha-ching. Ain't about the bubbling, bubbling. Wanna make the world dance. Forget about the price tag. It's not about the money, money, money. We don't need your money, money, money. We just wanna make the world dance. Forget about the price tag. Ain't about the cha-ching, cha-ching. Ain't about the bubbling, bubbling. Wanna make the world dance. Forget about the price tag. Yeah, yeah. Ooh. Forget about the price tag.